your primary doctor is the right person to help you manage that, at least at the beginning. You don't always need to see a specialist, but if you do, there are specialists around in the treatment of diabetes. Being told that you have diabetes is a pretty devastating thing. Oftentimes you feel as though something catastrophic has happened to you, and maybe you have to make an innumerable number of changes in your life, and it's going to be too daunting a task for you to do alone. So I think the important thing to remember is that there are a whole team of people out there who can help you make those changes. Obviously, your doctor is critical, and if you've got diabetes, in most cases, your primary doctor is the right person to help you manage that, at least at the beginning. You don't always need to see a specialist, but if you do, there are specialists around in the treatment of diabetes. But in addition to that, there are diabetes nurse educators or certified diabetes educators who may be dietitians or nurses. There are exercise physiologists who can help you understand what your exercise program should be. A lot of times there are hospital-based education programs, classes that are relatively low cost. You can learn an enormous amount. And there's an awful lot of good information out there online and in many books. So I think you can educate yourself. You can call upon people to help you make the changes that you need to make. Many times when people are given a diagnosis of diabetes, they can become pretty depressed about it because it is a disease that can have catastrophic outcomes. I think what's really important, though, is to remember that negative things don't have to happen in diabetes if you change your life and you control your blood sugars properly. The likelihood of serious problems from diabetes goes way, way down if blood sugar control is good. And in fact, if you have well-controlled diabetes, the likelihood of problems that result from that are not much greater than in the general population. So it can be challenging to keep yourself upbeat and positive when you receive negative news like, I've got diabetes. But remember that it's largely under your control whether that's a serious problem in your life or whether it's something that you deal with effectively.